We touched on lots of different areas. So patient and family engagement, which was really important. Risk management, also really important. And briefly on high reliability systems. So what should be the priority areas for the next year or two? Any thoughts?
For me, the priority over the next year and more really needs to be about the staff and staff wellbeing and mental health, because we know the impact of poor staff wellbeing and burnout on patient safety.
I think the problem is that there is no indicator, objective indicator to measure well-being or mental health. Using our method, if there is free text data, maybe there is one option or one option to measure those resilience or well-being.
I also have been long wondering how we can apply the idea of resilience to our clinical practice. I think practically speaking, one of the focus is try to eradicate that conflict or inconsistency between our manuals or a conflict or long-lasting practice.
One of the things about the pandemic that has been shown so hugely is that when things happen, and it's been a massive disturbance in terms of how care is delivered, teams have self-organized around the problem. And that is such a fundamental principle of resilient healthcare.
Do we need to have first the way to collect more data? Or do we need to have the more compute infrastructure to analyze the data?
I think it's about how do we try and improve the quality of data. And Paula talked about this, loads of people have talked about data quality. So I'd say data quality through actually providing electronic medical records that actually add something to the clinical staff.
It's not just about data quality, it's about data relevance. So I think that more time should be spent deciding what are the most important data that we need to collect.
I find it quite difficult often to prioritize data or make a decision which is more important or more relevant. So how do you think you can make such a judgment?
I personally always start with what are the most important health outcomes that you're trying to improve. And so what are those that are most important for decision makers? And decision makers includes patients and healthcare professionals.
Because now most deep learning or AI is like, just like a black box. Maybe we need is interpretable or explainable. In this case, maybe I think if the data, not only just the final level, the process, how to reach the level will be very important for the future deep learning.
We know that in the world of computer science, sharing and passing that data on to other people to improve our algorithms, with them sharing the information back, is really helpful. So I think it's about sharing annotated data sets.
I think the key thing is to produce translational clinical informatics, and to basically try and get this stuff, off benches back into clinical practice.
Yeah, the first thing we should do is to establish that kind of a data set, I think. Yeah.
What is your possible collaborators in the future? Because aging researches require interdisciplinary collaboration.
That there's a wide divergence of talks that we've heard. There's a number of common themes, aren't there? People are recognizing the importance of exercise and nutrition, and that's running through both the basic science aspects of things and also into the social care and how we deal with older people.
we're doing a knowledge transfer partnership around app development. It's called Power, and it's about exercise and strength-based exercising for individuals, predominantly at home, but we do also liaise together with the NHS, the National Health Service here, and also care homes.
We train older individuals, but we don't know what they do at home. So I think your indication of monitoring the condition of patients or older individuals daily to adjust maybe the interventions for nutrition and exercise would be the more important aspects in the near future.
Just while I have the floor, just another point, I think going back, Professor Jackson, to your point about neurological impact, I think that's somewhere where there may be a clear bridge between the more scientific side of the work and the more social scientific side of the work, and thinking again about what Jane was just saying about the intervention work that they're doing. If there's a way for us to assess the neurological impact upon these interventions,